Hello there. Welcome to the first episode of Zero Friction, Removing Barriers from Revenue Growth. I'm your host, Terry Kuchaluchis, the founder of RevRx AI. Today, I'm excited. I'm joined by Nathalya Mamane, the CEO and co-founder of AnywhereDx. We'll discuss her journey in diagnostics, the mission behind her company, AnywhereDx, and the challenges of bringing innovation into healthcare. Nathalya, we're very excited to have you and welcome to Zero Friction. So, Nathalya, tell us a little bit about yourself and the company.
So, I'm the co-founder and CEO of AnywhereDx, where we are truly on a mission to democratize diagnostics by changing access or activating more access with affordability to the consumer so that they can test when they need it, where they need it, anywhere they need it, affordably and accessibly. We have developed this technology in a diagnostic solution that will allow people to test for a variety of different diseases from the comfort of their own home when they need it, and with very, very high sensitivity for reliability. And we're doing this with in the most challenging way, and how I got to building a company that is so challenging. But the most challenging way is to create a test that allows you that is consumer based, so that's consumer friendly, but that is at such a low cost that anybody can afford it. And being able to do that, being able to do a lab grade test, a lab grade quality test at the price tag that we're looking for is really what's proving to be quite challenging, but realistic, and we're making it happen.
Well, that's great. And so you're talking about bringing all this innovation to the diagnostic marketplace, bringing something that's disruptive, that's virtually accepted and can be accessible by everybody. So tell me about your journey into this diagnostic world, because I think this is a really interesting angle.
So it was interesting because I'm not from this space at all. People always think about like, what are you doing? I actually have two lives, and we're gonna and my sort of like point of change was when I decided to do my MBA in 2019. I started in 2019. So prior to that, I actually was an event planner and and I had my own business, and I was in the industry for about 18 years. I had my own business in event planning for about 13 or 14 years. And just felt that it wasn't, meaningful to me. It wasn't impactful to me anymore. I was good at it, but it wasn't fulfilling me. So I couldn't figure out what to do next. Of course, everybody needs some pivot in their life. I decided mine was a complete 180. And so I decided I'm going to go back to school. Let me learn and let me see what I've missed out on. I was 45 years old and I had 4 kids. One was out of the house, the other ones were home, and trying to kind of figure it out and say, I'm going to learn and see where that takes me. I actually had no preconceived goals, or I had no idea what this was going to take me, but I was just going to go. And I hadn't been in a classroom for a long time, so I really had to truly understand what it meant to write a paper all over again, which I hadn't done in a very long time. You don't write paper in event planning. And so I went back to school, and one of my classes, which is a very typical class in an MBA program, is to create a company or an idea of a company and develop it. So you learn accounting, you apply accounting to your idea. You learn marketing, you apply marketing. That's sort of like how it goes. Very typical, very standard. So I'm here with my team trying to figure out what is going to be our business idea. And I think back at that very moment, I think back about having sat in a room of 1,000 people, hearing the founder of Waze. And he basically started off with saying, the best ideas come from the biggest pain points. And he hated traffic. He just couldn't stand being in traffic. So he figured out a solution, because his problem is probably a lot of people's problems. So I thought about my life, and I thought about, well, what's my biggest pain point? And we have a lot of pain points, but the one that really triggered me was waking up and any given morning or weekend and one of my kids being sick and wondering, what is my day going to look like? And having to rush to find a doctor at any point in time to get them tested for whatever it could be. Generally, or at the time, they only tested for strep throat. So testing them for strep throat and then finding out whether it's strep, I get antibiotics. If it's not strep, I do nothing. And this was a complete waste of time. So that was my biggest pain point, because once disease hits a family of 4, it almost like, it feels like it never goes away. Like it just sort of like stays. It just cycles through every human. If only they all came at the same time, but no, one has to get better and then the other one has to come, right? I remember once when my kids were younger, I had like a bottle of antibiotics for all 4 of them at the same time. Like, because as you finish one, you get the next one. In any case, so that was my biggest pain point. My biggest pain point is having to go through the process of getting my kids evaluated for some common illness, generally strep or the flu or anything like that. And I said, you know what? Let's do an at-home strep test, because if it's not strep, what else would you treat for? It's a virus, and then the virus would just go on its own. So my idea was a strep test. And I thought if I had a strep test as a parent, my life would be so much better. Like out of control better. So, my team agreed to follow that idea, and we built the idea like in school. We applied accounting, we applied marketing, we applied, business development and what would be sales look like and all the partnerships and what the exit would be like, the typical business plan. And I'm like, oh, this is good. Like, I like this. This would be great for me. And, as part of the project, you have to like interview all these people, and everybody's like, this would be great. We would love this. And so I kind of like validated the market through this project. Now, at the same time as I was doing my MBA, my eldest daughter, was a senior in college at McGill University in bioengineering. And she overheard me at that point. COVID hit, so I was working from home. She was home, everybody was home. And she overheard me speaking with my team about this thing. And she's like, first she makes fun of me, and she's like, Mom, what are you doing? Like, this is not going to work. What are you doing? And I'm like, I don't care if it works. It just has to be an idea. It doesn't have to work. I'm not the scientist. I just have a good idea. And then she said she had to do her end of year project. And she's like, I have to do an end of year project. I'm going to develop it for you.
Okay.
And so it kind of went there. And I'm like, you do you, I do me. Let's just go on different ways. Like, I have no idea what you're going to do because you're a scientist, and you have no idea what I'm doing because I'm in business, but this is going to be fun anyway. At the end of the year, I had a legitimate business plan, which I thought was legitimate. I mean, of course, it's evolved over time. And she had a legitimate proof of concept. Correct. And I'm like, I think we're onto something. And that's really where things took off.
So at that point is when you thought you had a real problem worth solving.
Yes.
And a viable product to bring to market. And then you decided, hey, now what? Now you have a concept, you have a prototype, and you have a lot of will and ambition, right? And now
a lot of will and ambition, but absolutely no idea what to do with it.
Okay.
So the first thing we do is we knock on the doors of a whole bunch of like mechanical engineering firms, and they basically tell us, you don't know what the hell you're doing.
Okay.
We had no idea what we're doing. We didn't know where to start. But what happened was that I ended up applying to my first accelerator. Okay. Which was out of Babson. So I graduated from Babson and I got into this accelerator. And I remember when I got into this first accelerator, I literally thought I won the lottery. Like, hands down, my first yes. Who knew that after that there would be many no's? But my first yes. And so through this accelerator, you kind of like learn, you kind of get network, and then you meet people and you meet more people. And then from there, and Olivia, my daughter, her name is Olivia, she was sort of like, we were trying to figure out what to do. And then through meeting one person to another, I met what sort of like became my first team member at the time. Okay. And then from there, got another team member, and then from there got another team member. And so like then we were like a cohesive team that kind of like led to figuring out how we were going to sort of like start this thing. And then we did.
That's cool.
Yeah.
So what has been your biggest surprise about the diagnostic industry thus far?
I mean, my biggest surprise is the fact that diagnostic has the worst reputation in this health life sciences space ecosystem. Like,
Why do you say that?
because as a parent and just as a person, you would, the first thing we want to know when there are symptoms, any kind of symptoms, is a diagnosis.
Right.
Right. But what I realized being in this space and developing this is that the business side of it, right, is the fact that how do I explain this? There's a diagnostic and there's a therapeutics. Okay. And there's a lot more money being made in therapeutics than there are in diagnostics.
Okay.
So the general population of investors will put their bet on a potential higher return for therapy than they would for diagnostic. And so then you have all this money being raised in therapeutics.
Correct.
And then the diagnostic part is sort of like it would hinder it, right? Because if you have the right diagnosis,
right,
the most accurate diagnosis, then you may not use that therapy,
so
right?
The system's kind of broken.
The system is completely broken. And I was like convinced that like who wouldn't want a better diagnostic solution? In what world would you just want to just feed people drugs without knowing exactly what they had? But in fact, it doesn't work that way because what they really want is to make money, right? And yes, you have a lot of people who care, but there are stakeholders, and the stakeholders want their return, and there's a bigger return on therapy than there is on diagnostic. And so I was very surprised, and it's a battle that I am challenged with every single day.
Right. Especially in your quest as you're trying to get your company funded and moving forward. And I'm sure
exactly.
We'll talk about that challenge in a little bit.
Yeah.
So I do have a signature question for you. What is the one lesson that you've learned the hard way that's kind of shaping how you operate, you and your organization today? Like something that you've fumbled on or tripped on, or a challenge that you've had that, has sort of guided you?
Yeah. The one thing that I've learned is, I really thought that my personality, my passion, my grit would sort of like open doors for me, when in fact it didn't. That is the reason for this, right? But I really thought that with a great idea and grit and passion that you couldn't even reach, right? And complete dedication, that it would get me a little further. Door. And it's not so obvious because that formula changes with everyone. There's no formula. It's not an advantageous thing. So it's a very hard thing to manage. I'm not gonna misrepresent myself. This is who I am. I'm from this hospitality space that is so far removed from what we're doing now. And I was afraid of representing myself as somebody who had done that before. So I almost wanted to hide it for a while, but now I'm not doing that anymore. I'm like, I have skills that I've acquired from that actually is exactly where I have to be now, that will take me as far as I can take it.
I agree with you, and I think the best part of the story is that you're coming from a place of pain as a consumer.
Yeah.
Right? And I think that's, some of the best ideas are always drawn from the market itself. So that's a great story. So for our listeners out there, and they're just now hearing about AnywhereDx, you talked a little bit about it, about what you're trying to accomplish, but what is the real mission between you and AnywhereDx and the marketplace, and what are you trying to accomplish there?
So ever since I started, and now through AnywhereDx, so I just want to make sure we understand, my first company was called RT MicroDX, and then we sort of like restructured, and we structured under a new company called AnywhereDx. So this is where we are now. But from the very beginning, we sat on three very, very important pillars. It was accessibility, affordability, and reliability. Those three things were not movable. They were like set in stone. And so AnywhereDx is truly trying to transform how we face diagnostic challenges in the marketplace by offering accessible, affordable, and reliable solutions for the consumer to use for, a whole bunch of different indications. One of which is what we're beachheading right now, is an at-home strep test. So that you do not need to go to the doctor to get tested for strep. You do not need to go to the doctor to get diagnosed for strep or even to get treated for strep. You just need to grab a kit from your local pharmacy and test at home using a very different method. The regular method is a throat swab that is invasive. Our method is to use saliva so that it is much more accessible and much more usable for the consumer, and get results that are so reliable that physicians wouldn't have to redo the test for confirmation. And that was very important to me, because if you're going to pay for a test, the last thing you want is a doctor to say, let me run the test again. Right. So why don't you come here, and also you've already lost the money and the time to buy the test at the pharmacy, or have invested that money to buy this test, and then a doctor saying, I don't really trust it, won't you come? So that was not at all where I was heading. This is not a screening test. This is a diagnostic test where you can test at home and you can get treated from home. And when you say how do you get treated from home? Well, it's very important for you to know that we're offering the entire service. You buy a test, you get tested, or you test yourself, you test your child or your loved one, and then you get connected to a physician that will confirm and that will treat you and diagnose you. And we're streamlining the entire process, because what we realize today is 50% of the population globally, by the way, not just here, don't have a doctor to go to. They just don't. That's a lot of people. So where do they go? They're forced to go to urgent care or to the ER, costing them so much more than a regular copay. Today's copays are exorbitant prices because of high deductibles. So we are truly trying to slim things down and simplify things to, you buy a test for $25, you test at home, and you get treated without ever leaving your home. And that is not so far off from how the pregnancy test started. Sure. Right? That's how it started. It used to be that for you to find out if you were pregnant, you'd have to go and pee in a cup at your OB, right? You would have to pee in a cup and then bring it to the pharmacy for them to test. Right. And then the pregnancy test showed up in the 70s, early 70s, and all of a sudden it blew up because you could just do it from home. And then if you were negative, you could do it again, and you can do it again, and you can do it again until you were positive enough to call your doctor and say, by the way, I'm positive. And these tests have just gotten gradually better and better and better. So this is what we are truly trying to get into. This should be the standard. The standard is you don't have to drag a sick child or a sick person to the doctor. You can just test from home. And that goes for strep throat, that goes for UTIs, that goes for STIs, that goes for any of the hepatitis, TB. There is no reason why we couldn't offer the consumers, to have more control over when to get tested and how to get tested. It should be on their own terms. It shouldn't be on the terms of a healthcare system that's already extremely broken. Yeah, it's way broken. And so it's so nice that you're finding a way to create accessibility, affordability, and reliability at home, number one. Number two, it looks like you're doing your homework to get connected into some sort of virtual health piece, right? Whether it's through but even people who have health plans today, most of the health you can get connected through the phone, and exactly. So now you don't even have to leave the house anymore, right? And technically, you even have your drugs delivered to your home, so you might not even have to go anywhere, right? So at the end of the day, what a great experience for the patient, where they can get tested, get treated, and get their therapy all in one swift motion. So what a great opportunity. And what the problem is today with the telehealth platforms that already exist is that they work great if all you have to do is speak to someone, but it's still broken if you have to get tested. Like there are no tools for them to still do this at home. They're going to send you to a lab like a Quest Diagnostic or a LabCorp office for you to get the proper labs. Now, for some things, it's important, right? For, to find out your cholesterol, to get there are some tests where, even today, you could probably get your cholesterol at home. That will happen. Over time, we just need to bring these solutions closer to the consumer. And, the concept of having point of care diagnostics or point of care services is these facilities, the point of care.
For convenience.
Right. But now we have to get to point of need. And the need is at home. We need to stay at home. I think about all these older, the older generation that are in in housing, senior care. Yeah. All the senior, they're in senior care. The poor people, like if they have a UTI, they schlep them out of their home and take them to the doctor to pee in a cup. Right. That's all they're doing is to pee in a cup. Why can't we test this at the facilities there in their home? You can hear from me, like the passion is so real because I see these things every single day. I hear about these things every single day, and it breaks my heart because the technology is there for us to use, and we just are. And what we're doing is we're using it, and now we just have to just bring it to market.
Well, it's a great pivot point. So, I think that we've talked a lot about the problems you're solving, accessibility. What are the biggest friction points that you're finding as, a CEO and co-founder of a disruptive technology, right? So you probably have a lot of inertia just in general around it. But what are the big friction points that you're finding getting to market?
Finding capital.
Okay, money. Right.
Finding capital is the biggest, I think it's the biggest challenge today. We all know everybody's having a hard time finding capital, whether you're in biotech, in pharma, but in diagnostic is particularly hard. Again, because of the misconceived lower upside, right? I really do think it's in misconception. So finding capital is very hard. A lot of companies that were in diagnostic left diagnostic, and a lot of companies who are non-diagnostics do not, are choosing not to even take that on. So that's the biggest hurdle we're finding because the data is there, the technology is there, the talent is there to develop these things. The infrastructures are definitely there. There is no friction on the side of the physicians at all. I spoke to my kid's pediatrician and she's like, "Can you make this happen yesterday?" They're happy to see their patient, like this, right, virtually, and not have all these sick kids in their waiting room. So breeding all these germs. The friction is not in the marketplace. It's not even in the ecosystem.
The regulatory pathways are, if you had the money, all that stuff is going to fly through regulatory, the whole thing too, as well, right?
Yeah, there's no friction at the regulatory side. There's no friction on the ecosystem side with the physicians, with the patients, with the parents, there's no friction. We're not seeing any friction. And I can't even tell you, there will not be any frictions with those labs because I could even suppose that these labs would want to acquire some of these tests and then have it part of their offering. The future is going in that direction, yet the capital needed to reach that kind of the future milestones is still very limited.
Got it. So when you look ahead, what are you most excited about? Even though I know that we still got to work through the challenge of getting the funding and getting the money, right, and getting the capital. But what are you most excited about right now, today, and moving forward? Tell me.
Today?
Yeah, today. Figuratively today, but right, moving forward.
So we started a crowdfunding campaign with the goal with two goals in mind. The first one is to raise capital, but mostly is to show the signs of early adoption with parents who want this. And so my big campaign now is finding, 500 parents who are willing to invest $150, not a lot, $150 into this crowdfunding campaign as an early adopter. And what I'm excited about today is that these parents it's resonating. They're hearing it, and they're excited about it. And so when I speak to parents about it and I'm like, we're just looking for, yes, I'm in, right? Count me in. And it's not always just 150. It could be 1,000. It could be 850, whatever. So I'm excited about the fact that I'm not getting through to the investors, but I'm getting the investors that are their true customers. So when I started this, I started as my own pain point, and now I am speaking to parents to whom it's a pain point as well, and that they are like, they want in, they want a piece of this action. So that's what I'm excited about today. I'm excited, and no matter how hard and challenging it is to build this business, is that, I'm mostly excited to see one day our solution on the shelves of a pharmacy, and seeing how, we are kind of equalizing the playing field in this diagnostic space so that everybody can have the same kind of access. That's what I'm most excited about.
Got it. So what does success look like for AnywhereDx over the next few years?
I just need to see it in CVS. If I see a box in CVS, okay, that will be success. And by the way, by the time I see that box in CVS, this company may not be mine, right? I am very much aware that this company that I'm building with my co-founder may not be mine. But if it's there, we got it there.
That's great. What a good, that's a great sort of mission, and like a North Star for you to have, for sure. Where can our listeners, you've obviously got a website, you've got a WeFunder web page as well.
Yep.
Any other ways our listeners can learn more about AnywhereDx?
I mean, our website is good. WeFunder has a great video on there. They can follow me on LinkedIn. I post things all the time. But, we created a great video on WeFunder, and it really gives you a very clear path. And it gives you a clear understanding of what we're building, what it's going to look like, how it's going to be connected, and all the points that it's going to hit. So I really recommend that people see video. And it kind of sells itself. It doesn't take much to kind of opt in. It's $150 to opt in. You would get first access to strep tests as soon as they're ready to go. So that's where they can find me.
Okay, well, great. Well, Nathalya, I really appreciate your time today. It was wonderful being with you. You just bring such great energy, and I'm sure our listeners and viewers will find a way to connect with you soon. So thank you so much.
Thank you so much for having me.